the Centers for Disease Control and Prevention, CDC, is embarking on a significant research endeavor, a large-scale study investigating potential links between vaccines and autism. This move comes amidst a surge in measles cases, one of the largest outbreaks in the U.S. in over a decade, with a grim toll of over 150 cases and 2 fatalities across Texas and New Mexico. The outbreak's alarming escalation is directly linked to declining vaccination rates, fueled by the persistent and demonstrably false claim that vaccines cause more harm than good. This decision by the CDC, however, is shrouded in a cloud of controversy and unanswered questions. The study's inception coincides with a period of heightened public debate surrounding vaccines and autism, a debate reignited by prominent figures, including Robert F. Kennedy Jr., a vocal proponent of anti-vaccine views. While the CDC's commitment to scientific rigor is undeniable, the involvement of Kennedy, whose public statements have actively undermined public health efforts, casts a long shadow over the integrity and objectivity of the impending research. The question of Kennedy's participation, or lack thereof, in the CDC study remains unresolved. 2 sources familiar with the matter, speaking to Reuters, confirmed the study's existence, but offered no insight into the role, if any, played by Kennedy. Attempts to obtain clarification from both the CDC and the Department of Health and Human Services have been unsuccessful at the time of this writing. The silence from these crucial agencies only serves to amplify the concerns surrounding the study's design and intended outcomes. The timing of this study is particularly sensitive. The recent measles outbreak serves as a stark reminder of the real and devastating consequences of vaccine hesitancy. This outbreak, primarily fueled by misinformation and the spread of unsubstantiated claims linking vaccines to autism, has resulted in serious illness and, tragically, death. The CDC's study, therefore, carries the weight of not only scientific inquiry, but also the responsibility of addressing the urgent public health crisis caused by declining vaccination rates. Adding another layer of complexity to this situation is President Trump's recent address to Congress, where he explicitly mentioned the rise in autism cases amongst children, stating, "So, we're going to find out what it is, and there's nobody better than Bobby and all of the people that are working with you," in reference to Robert F. Kennedy Jr. This statement, while seemingly supportive of further investigation, inadvertently elevates Kennedy's influence on the issue, further clouding the objectivity and scientific rigor that should underpin such a critical study. The implications of the president's comments extend beyond simple endorsement. By singling out Kennedy, Trump implicitly lends credibility to his anti-vaccine stance, potentially reinforcing the very misinformation that has fueled vaccine hesitancy and the current measles outbreak. This public endorsement risks undermining the carefully constructed messaging from public health officials who have tirelessly worked to counter the spread of false narratives about vaccines. Senator Bill Cassidy's questioning of Jay Bhattacharya, Trump's nominee to lead the National Institutes of Health (NIH), further highlights the sensitivity surrounding this issue. Cassidy's inquiry focused on Bhattacharya's stance on investigating the purported link between autism and childhood vaccinations, underscoring the ongoing political and scientific tensions surrounding this highly debated topic. The confirmation process for Bhattacharya, therefore, has become inextricably linked to the broader conversation around vaccine safety and the role of scientific evidence in shaping public health policy. The CDC's decision to launch this study, while seemingly a response to public concern, is fraught with challenges. The potential involvement of Robert F. Kennedy Jr., a prominent figure who has actively propagated anti-vaccine views, raises serious questions about the study's impartiality and its potential impact on public trust in scientific findings. The study's success hinges not only on its methodological rigor, but also on its ability to navigate the complex political and social landscape surrounding vaccine safety, ensuring that its conclusions are both scientifically sound and effectively communicated to the public without inadvertently reinforcing harmful misinformation. The absence of immediate comment from the CDC and the Department of Health and Human Services only exacerbates these concerns, leaving the public and the scientific community anxiously awaiting clarity on this crucial issue. The future implications of this study extend far beyond the purely scientific realm. They will significantly influence public health policy, the fight against vaccine hesitancy, and the battle against preventable diseases like measles. The stakes are undeniably high.